The excess opiate theory, a rationale for a gluten-free, casein-free diet. Two foods that have always been somewhat problematic for me have been wheat and dairy. In going down many different nutritional rabbit holes, I have found one that is interesting, so I figured I would make a video giving a brief overview of the excess opiate theory and why trying a gluten-free, casein-free diet might be worthwhile. The gluten-free, casein-free diet is said to have the potential to help the following mental conditions: autism, Asperger's, ADHD, schizophrenia, anxiety, depression, as well as asthma, multiple allergies, colic, Crohn's, and IBS. Much of the positive benefits of this diet is anecdotal evidence, but some of these anecdotes include things like a survey of 25,000 parents of autistic children, with 63% saying that a gluten-free, casein-free diet had resulted in either a mild, moderate, or marked improvement in their children, as well as studies that demonstrate a strong association between gluten elimination and improved outcomes in schizophrenic patients. These outcomes included fewer patients and shorter time spent on the locked ward, faster discharge times from the hospital, and improvement on various behavioral measures. First off, what are gluten and casein? Gluten is a protein found in wheat, barley, rye, and cross-contaminated oats. Casein is a protein found in mammal's milk, being especially high in cow's milk. There are different ways that the proteins casein and gluten can have a negative effect on one's health, including allergy or autoimmune reaction to these proteins, but for the excess opiate theory, it is a different mechanism. The theory goes like this. Both casein and gluten are a large number of amino acids joined together. Ideally, someone with a strong digestive tract should be able to break these down into their individual amino acids, bringing them into the bloodstream to be used as the building blocks for things like muscle, skin, joints, and ligaments. However, when someone has digestive issues and is not properly breaking these large formed proteins down, they can partially break down into smaller peptides or a smaller group of amino acids joined together. The peptides that both gluten and casein break down into look and act very similar to opioid peptides. Casein breaks down into caseomorphine, and gluten breaks down into gliadorphin. Normally, with a healthy gut, these peptides would not be able to pass through the digestive system into the bloodstream. But if someone has what is called leaky gut or a more permeable gut lining, then these proteins can get into the blood. Studies have shown that those with autism, ADHD, and asthma are more likely to have intestinal permeability or leaky gut. This makes them more likely to have a reaction to the foods that make these opioid peptides during digestion. Just a side note, there are some other foods that can make these opioids, or exorphins, as they are also called. These foods include soy protein, spinach protein, egg protein, and rice and corn. However, many have noted that these are less of an issue for them, with soy being the most problematic behind casein and gluten. Once these opioid peptides have entered into the bloodstream, they can pass through the blood-brain barrier and bind and stimulate the opioid receptors in the brain. Once this happens, the symptoms of opioid can take place. This includes things like brain fog, spaciness, inability to concentrate, and a numbness to pain. This can also manifest in an addictive nature to these foods. If you find yourself constantly craving gluten or casein-containing foods, this could be one of the causes. This is especially true of children that consume large amounts of processed foods, as these are usually wheat-based, many containing dairy as well. The last way this process can have an effect is in the form of withdrawal. If one is consuming these foods daily for a long period of time, their body can develop an addiction, and removing both casein and gluten at the same time can cause withdrawal symptoms that can last roughly a week for casein and potentially longer for gluten. Some proof of this theory is that those with autism show significantly higher amounts of both caseomorphine and gliadorphin in their urine. You can do tests for both of these peptides if you are looking to check for yourself. Why try a gluten-free, casein-free diet? Number 1, if you feel symptoms after consuming gluten or dairy, like spaciness or brain fog, it might be an indicator that it's something worth trying. Number 2, removing gluten and casein from your diet. You can still have a very healthy, nutritious diet, especially if you replace them with fruits, vegetables, meats, and legumes. And number 3, if you try the diet for a period of time and don't notice any benefits, you can always reintroduce these foods. Be aware that if you are going to attempt this diet, know that if you are suffering the negative symptoms from these peptides, that you might feel worse before you get better. The withdrawal symptoms from casein being shorter, only a few days to a week or a couple weeks, whereas gluten can take longer to get out of your system, from 1 to 3 months. This is why if you're going to try the GFCF diet, it should be for a minimum of 1.5 to 3 months to start seeing the real results. However, you should start to see improvements after 1 to 2 weeks. Just a quick overview of how to do the diet. There are many gluten-free, casein-free cookbooks you can look into for more complicated recipes, but I find it's best to just start simple at the beginning. There's just 2 rules to follow when doing the diet. Number 1 is no dairy products. There are certain foods like ghee, which are extremely low in casein and can be used, but I find it best to just avoid all dairy products at the beginning, as well as additives to foods such as sodium caseinate or other dairy additives that are used in some foods. Dairy can be replaced with any kind of dairy-free milk. My favorite is cashew milk, but it's getting a little hard to find now. Rule number 2 is no wheat, barley, rye, or oats. If you can find oats that are guaranteed gluten-free, then you can consume those. Otherwise, all other grains, including rice, corn, quinoa, buckwheat, are acceptable. You also need to look for hidden sources of wheat or gluten, including things like soy sauce that add wheat. But for most of these, you can find gluten-free options nowadays. There's still lots to eat. Cooking at home can be easy. However, eating out can be tricky. Some examples of meals would be rice with chicken and a gluten-free soy sauce, lettuce wrap hamburger with fries, spaghetti with pasta made from either bean or corn, a gluten-free cereal with a nut milk. Desserts would be ice cream made from either fruit or nut milk, a gluten-free, dairy-free pastry, or just a piece of fruit. Again, this is just a theory and nothing is set in stone. And as more information comes out, opinions can change on these things. But many people, including myself, have experienced benefits of cutting these foods out and find the hassle of avoiding them to be worth it. The biggest benefit I noticed for myself is much less brain fog. I feel mental clarity when I avoid gluten and casein and experience mental fatigue or slowing down of my mind if I do consume these foods. The brain fog was something I lived with for a long time, so I wasn't really aware that it was happening until I removed these from my diet. Once I experienced my mind functioning properly, it was worth to stick to the diet and avoid these things. Some other benefits I've experienced is improved sleep, digestion, exercise recovery, and energy overall. I try my best to stick to this diet, although I do cheat once in a while. I notice it takes about a day or so for these benefits to return after my cheat meal. I encourage anyone watching this to experiment, not necessarily with this diet, but any dietary changes that resonate with you and seem to make sense. Just do your best to be honest with the results that you do or don't obtain. And if anyone has a longer-term experience with the gluten-free, casein-free diet, please comment your experience and any changes you've noticed or any recipe options, as I've been trying to find a gluten-free bread and most of the ones are not very good. So thanks for watching and subscribe for more random health videos.